That was an oral presentation that I was fortunate to give yesterday on behalf of the Validate Consortium. And the Validate Consortium is a collaboration between 14 US-based academic centers. And this database includes patients with higher risk myelodysplastic syndromes who were treated with hypomethylating agents in a frontline setting. And as you may know, the response assessment for myelodysplastic syndromes has been based on the IWG, or International Working Group, response criteria, and they were last revised in 2006. And subsequently, it has really been shown that some of the response criteria that were included in the 2006 version did not really correlate with overall survival. And then last year, I was fortunate to be part of an international panel of experts that revised those response criteria, and they've recently been published. And the background for this project was, can we validate those new response criteria in this large retrospective database? And so what I was fortunate enough to present yesterday was the validation of those new response criteria with a specific focus on the new definition of the complete remission, and as well as the introduction of the near CR endpoints that were included as provisional endpoints in the IWG 2023 criteria. And what we could show is that the patients who achieved a composite complete remission, as defined as complete remission, CR with limited hematologic recovery, CR with partial hematologic recovery, and CR equivalent, patients who met this composite endpoint had an improved overall survival compared to patients who did not respond. So that's one thing. And we also were able to show that patients with CR with limited hematologic recovery also had an overall survival that's comparable to patients who had a true CR. So those are really interesting data, and it really supports the validity of the new response criteria. However, this is only a retrospective data set, and will have to be validated by other groups as well, and we'll obviously see how those response criteria are being applied in future clinical trials.